We okay?
Madam Clerk, do we have enough to have a quorum?
Chairman Pitt said he would like to start at 1 o'clock. We were not going to wait for a quorum for this meeting.
Not a problem. Getting ready to start in 30 seconds.
Oh, we got Hall, me, Arrington, and Morris. Yeah. You ready?
He said 30 seconds.
Yes, we are.
Okay. Good afternoon, everyone. Excuse me. I'm Rob Pitts. I chair the Board of Commissioners of Fulton County, and this is a special call meeting for today, December 30th, 2021. It is approximately 1:01 p.m. Madam Clerk, please call the roll of the Board of Commissioners.
Chairman Rob Pitts.
Present.
Commissioner Liz Hausman. Commissioner Bob Ellis. Commissioner Lee Morris.
Present.
Vice Chair Natalie Hall.
Present.
Commissioner Marvin Arrington Jr.
Present.
Commissioner Khadija Abdul Rahman. Mr. Chairman, you have a quorum.
Okay, then would you call the roll of the mayors, please?
Yes, City of Alpharetta, Mayor Gilvin.
Present.
City of Atlanta, Mayor Bottoms or Mayor-elect. Chattahoochee Hills, Mayor Reed.
Present.
College Park, Mayor Motley Broom.
Present.
East Point, Mayor Holiday Ingram. Fairburn, Mayor.
Here.
Oh, thank you.
Dina Holiday Ingram's here.
Yes, ma'am, thank you. Fairburn, Mayor Carhurst or Mayor-elect.
Mayor-elect Mario Avers here.
Hateville, Mayor Hallman. Johns Creek, Mayor Bodker or Mayor-elect. Milton, Mayor Lockwood.
Mayor Lockwood here.
Mountain Park, Mayor Steele. Palmetto, Mayor Bodie.
Present.
Roswell, Mayor Henry.
Present.
Sandy Springs, Mayor Paul.
Present.
South Fulton, Mayor Edwards.
Here.
Union City, Mayor Williams.
Present.
Okay. Well, thank those of you who are in attendance with us today. We will proceed with the agenda. There's one item on the agenda, the adoption of the December 30, 2021 special call meeting agenda. And the agenda, it's only one item, discussion with the Fulton County Mayor's COVID-19 update. And who will be making the presentation, Mr. Manager?
Yes, sir. Matt Kallmeyer, Director of Emergency Management, will lead, I think, the presentation along with Doug Schuster from EMSI. Matt.
Good morning. Thank you, sir. We'll go ahead and get it started. Really, what we're going to do is give you guys an update since Christmas Eve, how things have progressed. We also have some late-breaking information from the Board of Health EPI team that I'm sure Dr. Paxton will cover. Not good news, very unprecedented in the numbers that we are seeing, and hopefully give you guys a better understanding of what the latest CDC guidance is that has come out to help you all make informed decisions in your neck of the woods. So to get started, Doug, let's go ahead and run through the update of the slides and the models.
Thank you. Sound check and video check. You all see the screen?
We can.
Sure.
Okay, thank you very much. So kind of give you the update. We met 1 week ago. We were at unprecedented kind of projections and highs at the time, and we have surpassed what we thought was going to happen. Yesterday was a record day in Fulton County with 2,427 cases reported for the county. Also a record day for the state at 13,700 cases, and a record day for the United States with over 500,000 cases reported in a day. The maps that you see from last week to this week, obviously the darker colors mean, the less healthy. You can see it's starting to spread throughout the state now, kind of emanating from the Atlanta metro area. And close attention to the far right chart that shows us almost double our previous high, and we are 680% worse than we were 2 weeks ago. Probably the most disturbing of all the slides today is this one, where we are tracking positivity of all those being tested within the county, state, and hospitals. And the county is at 29.1%, and that's up almost 15% in just 1 week's time. And we've never been over 16.7% in the county. So almost 1 in 3 people getting tested are coming back positive with COVID. And to illustrate, I'm sure Matt will talk more about this a little bit later, but I wanted to show you, this is our points of collection for testing in the county for the Fulton County Board of Health and AFCEMA teams. And you look at the 1 week change from last week is up 400% in testing. And I'm sure the good doctor and Matt will have more to say about that, but the just kind of dramatic rise in testing, which is a leading indicator. As I said, most people who are symptomatic tend to go get tested, and which will lead to high caseload, which we've already seen, and then hospitalizations, which I'll talk about in a second. I shared with you the projected model for the next 3 months. And if you look at this very closely, I want to reiterate, the black is where we've been, with a previous high of 780 in January 3rd of last year, and a summertime high of 472. We are currently at 1678 and projected to be 3,000 cases a day for a 7-day average at the beginning of February. And so we're halfway there. As bad as the news I'm giving you, we're only about halfway there as far as cases go. And hospitalizations, I'm going to spend a little bit more time here because they're going up more dramatically than expected. Last week, you were talking about hospitalizations and deaths as related to Omicron. Dr. Paxton will talk more about this later, but it does look like unvaccinated people, the severity of the disease, of the variant, is about the same, which means if you're unvaccinated, the chances of you progressing to the hospital are pretty significant. And we're seeing that play out as most of the new inpatients are unvaccinated. And we have an inordinate amount of children and adolescents that are now being admitted to the hospital. CHOA is full at this time. And we are approaching very quickly our summertime high for hospitalizations. And to really drive the point home, overnight, 99 additional new COVID patients in the county hospitals. The death projection, like I told you, leading indicators are testing and positivity. Trailing indicators by almost a month are deaths. And so if people progress to the hospital, it's inevitable that some will progress to death from COVID. And so, as you can see, there's 230 projected deaths for COVID between now and April 1st. Last week, we gave you the bottom slide on the breakup between Omicron and Delta. A lot higher sampling size went into last week's totals, and they've they've updated their projection of what they think now is Omicron and Delta. So the top is the latest data from last week, and it's showing orange is Delta, purple is Omicron. In the state of Georgia, I think we're at 76% Omicron and 24% Delta. And like I said, unvaccinated, they're almost indistinguishable as far as severity, but vaccinated, there is some hope. And I want to show you CDC posted guidance for masking guidelines back at the end of June. The criteria is over 100 for new cases per 100,000 for a 7-day period. And we are 11 times over that at 1,111. And for percent positives, we're 3 times over that at now 29.79% for masking guidance. And I'm going to turn it over to Dr. Paxton to do the next couple of slides if you're ready to go, Doctor.
Yes, I certainly am. As many of you are aware from having read the papers, CDC put out some updated guidance about quarantine and isolation a few days ago. And I want to preface all this by saying that this is actually kind of a concession to reality, to the fact that we have so many people who are now testing positive, and that it is affecting the workforce pretty much everywhere. And so what the CDC has done is they have looked at the data and tried to come up with sort of a happy medium that would shorten the isolation and quarantine times, yet still allowing people to get back to work or school or whatever, and yet not allow just unmitigated spread. And before I explain this, I'm just going to put it into context of what the usual quarantine and isolation is, because I think it's good for you to understand this. In that, what we know from and have known for a long time is that when someone tests positive, generally by about 10 days after they have tested positive, presuming they're not getting worse and having worse symptoms and all that, usually by about 10 days afterwards, their amount of infectious virus has dropped a significant amount. And so that's why for months now, we have said that if somebody has tested positive and they are still, and they're feeling well, that after 10 days, their isolation period can end. That differs for people who are contacts, because what we also know is that if you are a contact, meaning you've been exposed to someone, but you are not yourself positive, that usually the incubation period is that by 14 days, if you haven't turned positive, you're unlikely to turn positive. So that's why, and people don't understand that, but that's why the quarantine period has always up until now had been 14 days if you're just a contact, but only 10 days. But that's because of what we know. What the more recent data has shown, particularly with the Omicron variant, is that it appears to it's obviously more transmissible. We talked about that, but it has a sort of a shorter time period, and that the most transmissible times are about 2 days before people start having symptoms up to about 5 days after. That is actually really for the people who are vaccinated. As I mentioned before, when a mayor on this call who made the point, which was actually incorrect, that saying that that vaccinated are contributing as much as the unvaccinated to transmission. That's not actually true. It has been shown that the people who are vaccinated have a shorter period of being transmissible. However, so here's what we have, and the last thing I'm going to explain is what the difference is between vaccinated and boosted. Vaccinated, for this case, means that you have had your full 2 doses, but you have not necessarily had your booster dose. The booster dose is recommended for anyone 6 months after their second dose. So after that long preamble, so you can kind of understand this. What the recommendations are from CDC is that for people who have tested positive, they absolutely need to isolate. And they should isolate for 5 days at home, not, stay at home, don't go out, don't expose anybody else. However, due to these circumstances, they are allowed to come out of isolation, but they must wear a mask, a good fitting mask, and really avoid being around people to the extent that they can. And the reason is because even though most people will not be that infectious after 5 days, there's still a proportion who might be, all right? And you should not come out of isolation if on that 5th day, if you have a fever or your symptoms are continuing to be bad, you should continue to isolate. That just makes good sense, okay? So that, to facilitate all this, they made it the same for anybody, regardless of their vaccination status, even though we know that if you're unvaccinated, you are going to be infectious for a slightly longer period of time. We just know that, but anyway, this is a concession. Now for quarantine, I'm just gonna, can you go back just a second so I can finish up? I'm sorry, I talk a lot, but the main difference here is that if you're both, again, unvaccinated and vaccinated, we know unvaccinated do worse and they spread it more, but if you are a contact, the recommendation is the same, that you should isolate for 5 days, okay? And after the 5 days, it is recommended that you get a COVID test on that 5th day to see whether or not you became positive or not. If you became positive, then you switch into the positive protocol above. And that's the same for the unvaccinated and for people who are vaccinated but are but have not gotten their booster, who are due for a booster but haven't gotten it. If you have gotten your booster, then you're good. You do not have to quarantine. But we do ask that if you have been a contact, that you do the full 10 days of wearing a mask and also get tested at 5 days after exposure. So I took a long time to go over that, but I just wanted people to understand it because it is a change and it is a concession to the huge numbers of people that we are having go out. So I think if you want to go to the next slide, Doug, I can explain a little bit more about the booster thing. Here's what we know. These very safe and very effective vaccines, I will always start off with saying that because that has not changed. What the data has shown is that Omicron is more transmissible than the previous versions, Alpha, Delta, and others. What we found is that the data is showing that people who are fully vaccinated, that the effectiveness of these vaccines is still amazingly high for keeping you out of the hospital, keeping you from getting intubated, for keeping you from dying. And that has not changed whatsoever. What has changed is that having just the 2 shots, there has been some waning efficacy. And so if you're more than 6 months out of getting your 2nd shot, the efficacy against the Omicron variant is about 35%. When I say that means of getting infected at all, okay? So even an asymptomatic infection. So it's about 35% effective for that. However, if you go and get your booster, then not only do you increase your antibodies against all the other versions too of the original viruses you see in that red block, but the important thing that Doug is circling here is that your efficacy against even the Omicron variant goes up by about 25%. And so you are about 75, and maybe in some cases I've seen 80% protected from even getting the infection from testing positive. So that is the reason why we are telling people, go get your boosters. And if for some reason you're one of those holdouts who hasn't gotten your primary vaccinations, waste no time, do it now, because this is a crisis. And I wanted to explain to you what we know about the boosters. And I think that's it for now. I'll pass it back to Doug for the rest.
I'll take it from here, Dr. Paxton. Thank you. So we shared with you all before our desire to go ahead and reach herd immunity, which is 75% of our population. We have a total of 916,000 individuals that are considered eligible to be vaccinated. So 75% of that does take us to the 450,000 mark. So far, and this is something that we can all go ahead and share in the success of this, that we have vaccinated 65% of our population. 592,128 residents have been fully vaccinated. That is the 1st and 2nd dose that Dr. Paxton was just speaking to. So that is definitely in the right direction. 10% more, we're going to be right where we want to be. But that still looks at another 95,322 individuals we need to get there to get to that particular number for our goal point. What we'd like to also make sure you guys are aware of, and this is where we need your help, of the 592,128 individuals that are fully vaccinated, only 36% of those folks have taken advantage of their booster shot. We know some individuals are still waiting for that 6-month period of time. but some of them are eligible already and have not taken advantage of that booster dose. We need your help to amplify that message, get these individuals to our vaccination sites so we can go ahead and increase their immunity levels. So that being said, we want to show to you what we're looking at in January, the first quarter of next year, and how we're going to be nimble, how we'll be able to go ahead and move our resources around to be more flexible. But we've increased our capacity by 63% since the last time we spoke to you all. We went to about 1,000 individuals today a day that we can vaccinate, and you'll see the fixed sites that we have on the screen there. There's an additional fixed site that we have. They'll be taking care of some downtown footprint. There'll be 10 Park Place, but for the most part, you'll see on your screen the major sites that we have, as well as 2 additional Board of Health clinics. And then we'll have 2 mobile units that will be deployed throughout to the community to get the hot spots, to get the places that we see that are having really low uptake of vaccination totals, and try to push deeper into those communities. The other thing that we can do is each one of the fixed sites that we see up there is staffed with mobile resources. So if we start seeing a waning of individuals that want to get vaccinated, we could take that, move those teams throughout our community, be able to be more nimble, more reactive, as opposed to just a fixed site where we're pulling people to us. We can now push vaccines to the community in a much more concerted effort. How are we doing this? We're making sure we still have more evening vaccination opportunities. It's something that we have shown over the last 2 months has performed quite well, and we will continue to offer that, rotating through our different fixed sites, making sure that everyone in our jurisdiction has that opportunity. The Board of Health has done an incredible job of acquiring a health equity grant, as well as the ARPA funds that the county has, and hopefully leveraging some of your funds as well that you have received from federal allocation to support this COVID response. The Board of Health is also doing what they can to reallocate their resources to better respond to the situation. So they have some core epi teams that will now be moved to a home testing and vaccination model. This is only for people that are homebound. This is not going to be for individuals that choose not to come out. These are for people that have no other way of getting out of their home to be able to go ahead and vaccinate. So it'll be a very specific program, but it's something that we're proud to say that we have, that we can still could take care of those individuals. The Unified Advertising and Community Outreach Program is continuing between the Board of Health and the county. There's a lot more that can be said on that, and I do not think I could speak eloquently enough on that. Jessica Corbett and Darrell Carver from the county and the Board of Health could probably go much more detail on that, should we need that. And finally, want to show you how incentives are working. We have actually spent $250,000 on incentives, 2,700 individuals that we have motivated to get vaccinated. We're not done yet. We want to continue to do that, want to continue to try to entice individuals to go ahead, come out to get vaccinated, get that first and second dose, and that's what we're going to continue to do. At this time, there is no desire to go ahead and offer incentives for boosters because of the demand that we have, but we can always be nimble and look at that later in the future. Specimen points of collection. I think that's something that we thought we put to bed a little bit back in the beginning of the end of 2020, beginning of 2021, but we need to go ahead and continue to support this operation. We have 3 fixed sites that we have located north, central, south in our jurisdiction. And what we're trying to do is increase the traffic management and security presence at these sites. It's becoming quite difficult to accomplish this. We have reached out to a lot of your law enforcement leads to see if they can support us. I want to go ahead once again and appeal to you all to support us in any way, shape, or form you can. Regretfully, we heard some bad news. We put a request into the National Guard to get some support at all these 3 sites. We were hoping that we could get it as early as next week. It seems like it's going to be closer to the middle of the month of January before they become available. So we are leveraging the sheriff's office, the marshal, any of the local law enforcement bodies that can support us. And I will go ahead once again and say, if you can spare any resources in your community to help us vaccinate your citizens, I would greatly appreciate it. We want to make sure these sites are safe and secure, and people can come and know that they'll have a really safe, lack of better words, opportunity to be able to go ahead and get tested. We'll continue to operate our home equity test program. This is something that I know that I joke with Dr. Paxton and Doug often about. The fact that there was 2 test locations, pilot locations within the country that were chosen to go ahead and do this initial program. It was Hawaii, which is where I was born and raised, and Fulton County, where I currently reside and work. So I wish I could say I could take credit for that, but it is a coincidence that that's working out in that favor. So 187,000 test kits were deployed. About 11,000 went to our school system. So 373,000 tests were actually done through that program. The Board of Health now has taken their equity grant and has used $750,000 worth of funds to be able to go ahead and procure about 46,000 test kits. And I think that will they'll go ahead and move us into our next slide, transition us into our next slide, where I believe Jessica or Dr. Rochelle will talk to us a little bit more about what this is looking like, or Dr. Paxton, not sure who exactly would it be.
Well, I can start in on this. As has been mentioned, we have an equity grant. And so what we decided to do is to use some money from that grant during this bridge period that everyone is waiting for the rapid tests that have been promised by the federal government to the tune of about 500 million. But it's not expected that those will really start being available until sometime possibly in January. So we wanted to bridge that gap, and we used money from our equity grant, enough to buy 46,000 eye health test kits. And we had originally, thought, well, it'd be nice to give one person 4 tests, because each kit has 2. But there's such a huge demand out there that we have to be very conscious of trying to reach as many people as possible. So we have the 46,000 test kits, each has 2 tests in it. So we'll be able to distribute just one of those kits to each of these people. As I said, this is funded through our equity grant. So they cannot just be widely, distributed to anybody in the streets. It is designed to be for us to make these available in areas where there is high case rates, low vaccination, and of course, where there are already healthcare discrepancies. And so we are going to, we're very actively working on our distribution plan as we await the tests arrival. And what we're going to do is, I know people have already started sending me, emails requesting tests. And so I'm again begging for a little patience in that, as you can see, we're not going to have millions and millions of tests, and we are going to have to be very thoughtful about how we distribute these for maximum benefit. So we will be, as we get closer to as the tests arriving and we have worked out the plan, we will circulate all that information to the commissioners and the mayors so that you can share those with your constituents, and we'll make it available, the information like on the website, so that we're going to try to be as upfront as we can, upfront and open, transparent about this. And so we will get that information out to you and to your constituents. Okay, is that back to you, Doc? Mm-hmm.
Yeah, Matt, you want to take it?
Thank you. I appreciate it. I think the final point here is we just wanted to make sure we had an opportunity to hear from you all. I'm going to actually ask the chairman if he would like to go ahead and answer some of the questions. I see some hands raised before we get to this kind of round robin, just to see what's happening in the neck of the woods of the cities. So Mr. Manager and Chairman, how would you like to proceed?
Any questions?
There are some.
All right, I can't see the hands, so can you see them?
Well,
Madam Clerk, can you see
there
the
are
hands?
some on chat.
Yes, we have Mayor Bodie.
Mayor Bodie, you have the floor.
Thank you, Mr. Chairman. This is for Dr. Paxton. I know we were relating to the 5-day period and everything like that, and I'm assuming that was from a positive test. Is there any guidelines on when a second test, such as a rapid test, I guess, should be administered, like on an employee, for them coming back to work when you want to check and make sure that they're not positive anymore?
Well, no, thanks. That's an excellent question, because actually what you should know is that once someone has tested positive, their test can remain positive for like up to 90 days. because particularly the PCR tests are very sensitive. And so they will pick up even dead, portions of the virus, okay? So that is why we actually do not recommend that you use any sort of test to return to work policy, because a number of people are just going to test, they're not going to be infectious, but they're going to test positive for like 90 days afterwards. So I hope that answers your question, but we really want to put the emphasis on people who are the contacts testing. We want to see whether or not they became infected. And so they're the ones that should be getting tested at the 5-day period to make sure that they have not become positive.
I understand on that. And the last question is, when we talked about the test being made available, the 46,000 that you had, is this a follow-up on the test we were able to get through our zip codes?
Yes, it's sort of along that same thought process. Again, targeting areas that have existing health discrepancies plus high case rates, low vaccination.
Great, thank you.
You're welcome.
Commissioner Morris.
Yes, a couple of questions. One is, obviously when someone takes a home rapid test and it's positive, there's no way for us to know that and add to the numbers. Have you all gotten an estimate to add to your numbers because of that, or?
No, we do not, because in order to do that well, we pretty much have to go out and do a survey. And you can see we are being inundated, even with almost 2,500 new cases by PCR since yesterday. We can't even keep up with case investigation and contact tracing. So we do not have the wherewithal to go out and do that kind of a survey.
Right. Well, that was my guess, and I guess the point really was that we're arguably understating.
Oh, definitely, we're definitely understating. I think I should have made that clear. Yeah, we're definitely, this is an underestimate of the actual number of cases.
Thank you, and thank you, Dr. Paxton, for your attention over the weekend to my particular issue. But my second question is with respect to hospitalizations. Do we know where we are with that issue?
I'm sorry, in terms of what do you mean? We have the numbers of how many people are getting hospitalized.
In past reports, we've gotten estimates of how the hospitalizations, I guess you've got the bed use here. Can you sort of, maybe Matt or Doug or somebody tell us what all that means?
I don't. This is an abbreviated briefing, sir. You'll get a full briefing by email later today with the hospital bed availability. So even though our numbers are drastically up with COVID patients, over the holiday period, traditionally non-COVID procedures are on the wane. And so we have very historically low non-COVID patients in the hospital last week and this week. But those numbers beginning on Monday are going to start to kind of creep back up, which will create a shortage. And like I said, we're already in starting to look at diversion at the children's hospitals right now. But for right now, we're okay. But like I said, that's basically a false artifact due to the holidays. So Matt may be able to tell more because I know he talked to the regional health director. Matt, you got anything from Matt Hicks to share here?
Not at this time. They're still going through the data, but it seems like the number one problem is staffing. So I can't state that enough. There is capability to surge within the hospital walls within our region D, is what our healthcare region is, especially within Fulton County specifically. Our hospitals have that capacity to surge. They just don't have the staffing to do that. It's a combination of people that are retiring early due to burnout, folks that are actually COVID positive in the hospitals and are unable to come back to work. And the final piece is just not enough staff to go ahead and meet their baseline needs. And now you throwing a surge on top of it is actually really crippling the system. So the other thing I did send out to everyone yesterday, I asked you guys to go ahead once again and amplify that message, was something that was sent out from the State Department of Public Health, a message asking citizens not to go to the emergency room to get COVID tested. I think Dr. Paxton can go ahead and continue to drive that message home as well. We need to ensure that the citizens are taking advantage of testing sites, but do not go to the emergency room to get tested. It's a cascade effect that is actually impacting our community. People are going to the emergency room, long lines there. Ambulances can't go ahead and offload their patients that are sick. They're sitting against the wall with a patient on their stretcher. That means there's an ambulance that cannot go ahead and respond in the community, which then makes our fire departments have to go ahead and have longer times on scene waiting for a transport a transport unit to be able to go ahead and respond to be able to take that individual to a hospital. So we need to ensure folks are going to the right place for what they're trying to achieve, and testing in an emergency room is not the right place.
So if I can sort of come up with a summary, we really don't know what's going to happen with respect to hospitalization use, but you're not necessarily expecting a crisis with respect to the surge for hospital bed needs. Is that?
I mean, I'm just jumping in here. I would argue we are already in crisis. So, I mean, maybe perhaps, I don't know if you meant in terms of the fact that the bed usage is maybe a little less than you thought, but we are having, I know people on the wards, it's horrible for them right now. This is horrible. I'd say we are in crisis. We're putting emergency rooms on diversion. There are lack of beds. There are pre-planned surgeries operations that are having to be put off because they don't have the staff to do this. I would say, Commissioner Morris, we are in crisis. Not when will we get there? We're there now.
Okay, well, in past reports back months ago, we would have projections about how we're not going to have ICU beds, we're not going to have regular beds, I just was wondering, with respect to Omicron and others, whether we were approaching that kind of situation again.
Like I said, in the absence of people being in the hospital this week because of the holiday for non-COVID reasons, but like I said, 100 new patients overnight, COVID patients in the hospitals, which is more than double of any one night increase. And the available beds just overnight alone went from what I would call a yellow condition, Commissioner Morris, we'll be in the red tomorrow. So we're there. And it's being masked only because of the holiday season. They're definitely under pressure, and the local hospital authorities are asking the state for assistance already. Thank you for that question. We appreciate it.
Next person.
Vice Chair Hall.
Thank
Vice
you,
Chair.
Mr. Chair. Thank you. Good morning, everyone. And Commissioner Morris, I hear a cold in you still. It's been a couple of weeks. I hope you get better. I wanted to address the isolation rules because I read an article just the other day that said the CDC director says new COVID-19 isolation rules were based on what we thought people would be able to tolerate. And so that being said, are these isolation rules really what we need, Dr. Paxton?
Mm-hmm.
Because if she based it on what people can tolerate instead of what is actually necessary, how can we be sure that we're isolating long enough?
Mm-hmm. Yeah, well, let me be honest. There's a lot of debate and discussion about that taking place among, physicians and other public health professionals about these particular guidelines. And I'm going to be just very, very frank. I think somebody else on this call before was talking about who was very much against mask mandates or mandating anything because we should rely on people knowing to do the right thing. a long time ago, I used to sort of believe that too. If anything, the last 18 months of this whole epidemic have shown me that unfortunately there's always a proportion of people who cannot be relied upon to do the right thing. I still have people sending me articles about how masks don't work, they're not going to wear them, how dare I ask their child to wear a mask in school, or things like that, or they're not going to get a vaccine. So what Dr. Walensky was referring to is that we already knew that when we had the prior guidelines, which called for people to stay home for 14 days if they were exposed, if they were contacts, or 10 days if they were actually positive, we are rife with examples of people that we'd follow up with them and they were already out and about. They were not following this, and we would talk to them and they would say, look, I need to go back to work. I don't feed my family, or whatever the thing was. So unfortunately, people were not adhering to what I think in my own mind is the gold standard for quarantine and isolation. Many people just weren't doing it, and they were just frustrated by it. And they said, how can you expect us to be off this long? So as I've been saying all along, these are sort of a concession to what we think can be supported, a shortening that can be supported by the available data, and that we are hopeful that will be more palatable to people. And so if they know that they can stay home for 5 days, but then be allowed out, they might actually do it, versus when we would say you have to stay home for 10 days or 14 days, at which point they'd say, screw, I'm sorry, I'm not going to do that. And I'm going out now at 2 days, So again, it's just a balancing act. It's not ideal. It's just a concession to what we know people are already doing, and what they have shown us that how much they're willing to do or not do.
Whew, okay, and so I'm just going to go back to, you mentioned a mayor spoke at our last meeting, and I believe that you may have been referring to Mayor Bodker, because I really appreciated what Mayor Bodker said during the last meeting. And what he said was, it has been proven that vaccinated people can catch COVID and they can transmit COVID. However, what I continuously hear out here, and I have text messages and phone calls from constituents saying, well, vaccinated people can't catch COVID, so why do I have COVID right now? How did I get it? I went to an event where everyone was required to show their vaccination card, and the majority of us caught COVID. So how did we catch COVID if we can't get it because we're vaccinated? And I think that we need to be very clear with people about what can and can't happen with them, because there is so much confusion out here. So can you please answer the question, do vaccinated people transmit the virus? We already know that they can catch it, but can they transmit it? Because there are those who believe that they can't. And so they don't care if you say 5 days or not. They're not retesting, and I'm urging people to retest, because just because it comes back negative one time doesn't mean that it won't come back positive the next time. And I've heard you say this a couple of times during this Zoom. So can vaccinated people transmit the virus once they get it?
Yes, I literally feel like I spend I spend hours every day explaining this to people, and I understand that there's a number of people who don't understand it. So I'm gonna try to be as concise as possible. In that, even talking about with the original virus, even when these amazingly effective vaccines were, the test showed that the trial showed that they were 95% effective, which is wonderful. But what we do know is that they're not 100% effective. So even then, we always knew that about 5% of people who had been vaccinated would still catch COVID, okay? You have to have COVID in order to be able to transmit it. So we knew right at the beginning that up to 5% of people might still get infected with the virus despite having been vaccinated. Now, with Omicron coming along and with the efficacy actually waning, so you'd expect there are going to be more breakthrough infections, all right? And so, yes, of course, it makes sense that some people will still be able to catch COVID. And if you catch COVID, then you can still pass it on. But what we know is that if you are a person who's having a breakthrough infection, during the first couple of days that you have this infection, your virus levels might be approximately the same as those of an unvaccinated person for a few days. But if you're vaccinated, you more quickly clear it, all right? By an order of a couple of days before an unvaccinated person does. If you've cleared your virus, you're not going to be transmitting it to other people. So all this means is that, yes, people can get a breakthrough infection, all right? And if you have a breakthrough infection, you can transmit it to somebody else. That's just how viruses work. However, the likelihood of your getting a breakthrough infection in the first place is much lower. I mean, the likelihood of you're getting an infection at all is much lower if you are vaccinated and boosted. If you do get a breakthrough infection, the likelihood of your transmitting, the likelihood of your transmitting it is less if you are vaccinated. And so all of this together is overwhelmingly on the side of get vaccinated. And so people have this image in their mind that vaccines are completely protective. They've never been. There's not a single vaccine that is 100% effective against whatever it's protective against. But the important thing is that word protective. It lowers your risk of getting the infection by a huge amount, and it lowers your risk of getting hospitalized or dying by a huge amount. Like, look at that. That is showing that of all of the hospitalized cases we have, that the fully vaccinated account only for 4%. It's 96% of the other ones are people who are unvaccinated. So, I mean, it's hard for me to think of any more graphic ways of explaining this to people. Get vaccinated.
Dr. Paxton, I'm not going to mix my words. The bottom line is that a vaccinated person can get COVID and can transmit it. And that is the major problem right now, is that they believe that they cannot. And when you said, once you've cleared your virus, what does that mean?
What it means is that when I'm using the word clearing your virus, I mean reducing your viral load to the point where you are no longer transmitting.
And how would a normal human being know that?
They will not. That's why we say that. And I tried to explain about the reason we don't recommend requiring somebody be retested after they've already tested once positive, because their test can remain positive for 90 days or more. So what we know is from studies that have been done in which, people who have been infected have been followed by scientists and their virus cultured, like on a daily basis to see whether or not it was still infectious. Those are the studies that told us that the majority of people by 10 days after testing positive are no longer capable of transmitting the infection. That is the origin of the 10-day period that I've been talking about on this call.
So if a normal human being has no way of knowing that they've cleared their virus, they have no way of knowing whether they are transmitting it or not. And the biggest problem right now is that people think that, oh, I'm fine, I don't have to be tested. But in actuality, we need to urge people to be tested. And I know you mentioned about the test and you know, the number of that we need to be very aware of utilizing them because we could run out and all of that. But the bottom line is that people do need to be tested. And there are a lot of people who think they don't. Let me tell you my own personal experience. When I was in the middle of being sick, and everyone on this call heard my voice the last meeting, I was very hoarse. And if I talked too long, I would cough. But I went through 8 days from a variation of having the flu one day and then just having cold symptoms. And for 8 days, that happened. I'm 100% now. But guess what? I tested positive after testing negative. If I had not retested, I would not know that I was positive. I would think I'm fine. I don't have any body aches, no chills, no none of that stuff. I'm fine. So why can't I just go out and be amongst people? I would not even know I was positive unless I retested it. And I've been trying to urge many people to retest because they're not. Even if they test the first time, it's hard to get people just to test that first time when they're sick because they're saying, well, you know, I can't transmit it, so it doesn't make any difference. So why do I need to get tested?
Sorry. Sorry, got a call.
So the other thing, Dr. Paxton, is that you know, when we were in the midst of this, well, you all keep saying that it wasn't that we're in a worse situation now, but we did open up some larger testing sites to try to help with the lines. Is there any plan to do that? Because I literally sat in a testing line for an hour before I was able to get tested, and I had an appointment. The testing site that I generally would go to if I needed to, they were just taking walk-ups, but I literally had to set an appointment, and the appointment took an hour anyway because the line was wrapped around the mall, in the parking lot, and then out of the parking lot and down the street. And the interesting thing is I received a call from my communications director because the AJC reporter had called and said, well, do you think Commissioner Hall can give us a statement about what's happening with the testing sites? Because we're hearing that some keep closing and all this stuff. I was literally in the line so I could give them a firsthand account of what it was like. So how are we going to approach this testing issue moving forward? Do you think we will have the ability to open up a larger testing site like we did before, because it works so well?
Well, what is, again, it mostly comes down to personnel. What DPH is already, we had a big meeting with the district health directors and DPH. They are already working to open up a larger testing site at the airport. I believe the airport had some part of it where they had just demolished something or other. They're going to clean that up and see if they can, institute one more mega testing site. But again, Commissioner Hall, one of the problems we're having now is with personnel. With testing personnel who are, perhaps themselves, sick or calling out, and the DPH and all of the districts they've asked us to, we're trying to move personnel over to testing, as much as we can, but we are limited. Like at the Board of Health, we actually don't have people, that to do testing that we can move over there, because we have people who've also, are out because they're on, they've had a positive COVID test. And we were always, for the last several months, like every single other district, we have had staffing issues with people, resigning because they're burned out. It's hard to work in public health during a pandemic, particularly with some of the reactions that we get from the general public and the like. So we've had as Matt has as mentioned before, we have people who've retired or who have gone on to much higher paying jobs elsewhere. So we've had a problem with personnel for a while, and we've managed to, sort of keep our heads above water. And so we are doing what we can with this. We have, as Matt has talked about, one issue we have, of course, is also with crowd control and with security. And so we're actually turning to you all, the mayors, the mayors, to help us with personnel to help manage that. DPH is working on putting together a larger, testing site so we can try to move, more people through. We are working on getting more rapid tests, out so that we can make those much more available. And we are working on this flat out and doing the best that we can. So, I mean, I wish I could snap my fingers and fully staff all, get all these personnel back, that we need, but we're doing our best to get everything staffed up and to move people through and to hopefully lessen these lines.
Thank you, Dr. Paxton, because that was one of the questions that the AJC reporter asked me. He said, is it the fault of the contractor that they're having issues at the testing sites? And I said, I absolutely don't think that there's a problem with the contractor. I just believe that it's staffing, that you had mentioned that at the last meeting, that there were staffing issues, even at the Boulevard and Highland site that we discussed. And I also added that, we have to remember that we are experiencing what they're calling the Great Resignation, and other people are getting COVID who are working in these facilities. So that just has compounded a bad situation. But I also do want to address the fact that I've been getting several text messages while we've been meeting, and people are saying, is it true that the testing sites are closing down due to the inclement weather situation?
Actually, Matt, I think you've got the latest information on that. Did you want to talk about that?
Absolutely. So we're trying to make sure it's safe. All of our testing locations is outdoors, basically to make sure that we can take advantage of the open air environment when people are removing their masks to do the swabs. Due to that fact, we are exposed to the elements. So one of the safety things that we do, similar to you would have an outdoor sporting events, if you have a lightning strike within 8 miles of any one of our facility, those individuals are brought into a safe location until we have an all clear for 30 minutes. Then they'll go back out and start the process again. We did work with their external affairs team for both the county and the Board of Health to make sure that everyone is aware of that there will be a lot of starts and stops today with our testing program. It's the best we can do. We have to make sure that it is safe for these individuals in these tents, especially with the lighting in the area. So we have not closed any locations today. I know some other jurisdictions just went ahead and shut down their whole operation for the day. We conferred with the National Weather Service as well as some other private weather entities that we use for our intelligence. And we looked at the fact that we will be able to squeeze some testing in different parts of today to make sure that we can continue to take care of our constituents. And that's what we're committed to.
Thank you so much, Matt. Thank you for that. And the last question that I've received is, if you're testing positive, are you still contagious?
Well, as I tried to explain, the nuance is that if this is a new test, we will assume that you are contagious, that you're in that, period that of contagiousness. If you're somebody who, for example, maybe for some reason they got a test and they were positive a month ago, it might possibly be that that's just because they're still positive from their prior test. So that was why I went into that big explanation with beforehand to explain about why we don't ask for retests from somebody who's been recently tested positive. But if you're going in today because you've got symptoms, these are new symptoms, and you're getting a new positive test, yeah, consider yourself infectious and follow the quarantine and the isolation guidance that was just on that slide that we presented.
So only if they have new symptoms and they're testing positive.
No, okay. What they should also do, anybody who's got a question should talk to their doctor, because I can't give a blanket thing here. But I'm saying if you if you've got symptoms, you've got any reason to think that you might have COVID, you should go get tested. Okay. And so that's all I'm saying is that if they've got symptoms, they should go get tested. If they, if they have, and if they've been exposed, then they should also follow the guidance that was put out there, and they should get tested at the 5-day mark after they have been exposed.
The question was, if they're testing positive, are they still contagious?
Okay, and I'm sorry, I'm doing apparently a terrible job of trying to explain the nuance of this. Is that person who sent you the text, is this their first time testing positive? Because if it is, yes, they should. It's like if they should be considered, they should consider themselves as being positive, and they should follow the recommendations that were just presented to you all. If you get the day you get your positive test, starts that 5-day countdown that you need to isolate. And then after those 5 days are over, you can stop isolating, but for the next 5 days, you need to be wearing a mask for a full 10 days. So that is, if that's the major thing I need to get across, let me get that across. I might have gotten a little bit, I probably been confusing you and getting too much into the weeds, because I was thinking about the former question about if somebody has tested positive, then should they get a retest like 10 days later to see if they're still positive? And that's when I was saying no, because if you had a positive test, particularly a positive PCR test, your PCR test can remain positive for 90 days. And you're not infectious, but you've still got a positive PCR test. So I regret now that I kind of went into all that much detail with you, because I don't want to confuse your constituent. For all intents and purposes, if they get a positive test now, consider themselves infectious, follow the quarantine guidance that has just been explained to you. And then they should contact their doctor, who can actually lead them through the rest of this nuance. So.
Okay, so okay, they just text and said, okay.
Yeah, I mean, I like I tell people, I'm a doctor, but I'm not your doctor. So they need to talk to their doctor to talk about their specific circumstances.
All right, thank you so much, Dr. Paxton and Matt and Doug. I appreciate all the help. These are some hard questions coming from the constituents, but thank you for all your answers.
Madam Clerk, who's next?
Mayor Williams.
Thank you. In light of all of the information, great information that Dr. Paxton and Doug and Matt have shared, this is something that is very concerning to me and very timely. Dr. Paxton just made a comment that we're in a crisis. So my commentary is going to be very necessary. And it certainly is around the issue or the lack of real attention to ambulance service. We have had this ongoing conversation for quite some time. One of the things that I'm very concerned with, I met with my fire chief and my city manager, and there have been ongoing meetings, with the South Fulton fire chiefs. And certainly they are our experts when it comes to ambulance service. So one of the things we're concerned with is that the commitment that was made with Grady, the county, and the cities has not been honored. When we look at where we are right now, other health emergencies are still occurring. Heart attacks, stroke, accidents, especially in the South Fulton County area, and other health-related emergencies. So we've got to have a conversation about what we're truly going to do when it relates to ambulance service, because they're not staffed as they should be. When you look at BLS or basic life support versus advanced life support capability, providing advanced level of care, those are the things we really need to address, because we're in this heightened epidemic right now with COVID, and it's almost like this is a push to the side issue, and we need to be having this conversation. I do want to also share, we're excited that we now have, representation on the South Fulton Chief, from the South Fulton Chiefs on the Region 3 EMS board. But there are other things that we need to be addressing when it comes to grading mutual aid, utilizing outside resources to provide backup on level 0 calls. These are too important for areas that already have lackluster service, but also with this heightened concern around hospitalization, overcrowding in our hospitals. So I'm very concerned with that. Wanted to bring this up to make sure that we didn't leave this off the table. And I look forward to having a deeper conversation around this, because this is crippling our communities. But I do want to thank Dr. Paxton and the team for sharing this information, because you cleared up a lot of confusion that I had as it relates to, don't vaccinate, do vaccinate. Are you positive? Are you negative? Should you send somebody who tested positive? Should you send them back until they get a negative before they can come back to work? So it has cleared up quite a bit. But I do want to thank you for having these calls in. But also, I need you to make sure, Mr. Chair and commissioners, that we continue to have this conversation until we get it right around this ambulance service and utilizing grading, because I'm ready to do something else. Thank you.
Thank you, Mr. Mayor. Madam Clerk?
Mayor Motley Broom.
I think Tax Commissioner Ferdinand was ahead of me.
I'm ready.
He's not a mayor.
Who do you want to go?
I think you.
Okay, very good. Thank you. Dr. Paxton, I've been very hard hit by this COVID 2020 almost. This morning, I had to close down one of my sites, the South Fulton Service Center. We had 9 of our 13 staff members sick. So it was untenable for us to keep that site open, so we closed it down for the foreseeable future. Now, since the isolation time is now reduced to 5 days, does it mean that we could open that site back up in 5 days?
Well,
6 days?
again, it all depends on your staffing. That's your call. All I'm saying is that this is what's recommended for your individual staff to follow. So they should be isolating for 5 days. But after 5 days, if they don't have a fever and their symptoms are getting better, or they never had symptoms at all, then yes, they can come out of isolation. They could go back to work as long as they're wearing a good mask all the time and, practicing the social distancing as much as they can, to cut down the chances of transmitting it to anybody else. So yeah, 5 days of isolation, but then can go back to work as long as they're following the mitigation.
Under certain conditions too, if they're feeling all right.
Yeah, they have to be. I mean, if they've got a fever, no, they need to keep on isolating. And if their symptoms have gotten worse, they should continue to isolate.
Now, my second question is, could an individual test positive for up to 3 times?
What do you mean by testing positive for up to 3 times?
Well, the county requires us to test all the time. And I know of one individual who has tested positive 3 times. Is that possible, or is it a human freak?
No, I'm saying, well, if they were positive, as I've been saying throughout this call, if they've been positive once, then their test, a PCR test is going to can remain positive for up to 90 days.
Okay, let me stop there a minute. And this is for the county manager also. We should probably send out a directive that for the test that the county requires, it should not be a PCR test, because it could. Go ahead, doctor.
Now, the PCR test is the more sensitive test. So if we want to find somebody who is actually positive, then you do want to do a PCR test. But if someone has had a positive PCR test, then you make them go through that protocol that we've just been talking about the isolation and all that, do the whole thing for the 10 days. But then they should be exempt from having to get a retest for about, for a certain period of time afterwards, because we know that their PCR test is likely to be positive again for up to 90 days.
Now, not all men are created equal, and some are more honest than others. Could an individual test positive every Christmas?
I'm not sure. I'm sorry. I haven't had enough coffee this morning. I'm not sure I'm following.
I'm having coffee now, sure, I can share it with you. But the point is, I think some employees are abusive to what I consider a pretty liberal and sensitive county policy.
Okay. Oh, I'm saying, or you're saying that they're falsely telling you that they're testing positive?
Well, they're sending paperwork that they said tested positive, and I have one individual who tested positive on 2 Christmases in a row.
I see. Well, I mean, like what you should do is like, if they've gotten a PCR test, it really should be coming on in an official format. I mean, you wouldn't accept a handwritten note saying I tested PCR positive. It should be coming through the lab, and we would have it if they were tested in a lab. That is put into the reporting system called SENS. And so that's how we at the Board of Health are then made aware of people who have tested PCR positive. So they shouldn't be able to, they can't fake that unless they have somebody on the inside who's going to do that. And that's not going to happen. That happens.
I don't think that's happened. But I think I'll probably have to forward this case to Kenneth. Because I'm quite concerned about this stuff, especially with that PCR test being so sensitive. I'm sorry, but
well, go ahead, Ken. We can talk to you more about it. But again, there are reinfections too. So I mean, it is possible that somebody could have tested positive last Christmas, gotten better. Their test could even have gone back to negative, as it would have, by six months or so, we'd expect it would be back to negative. And then they could have gotten reinfected again, because we have lots of people now who are getting reinfected after having been infected once, particularly if they're not vaccinated.
Yeah, vaccinated.
So that could definitely happen. So in fact, if they're not vaccinated, I'm not surprised that they would be.
No, this is vaccinated people I'm talking about now.
What? Yeah, so in general, we haven't had that many cases. I'm not even aware of any cases yet of vaccinated people who have had a breakthrough infection and then another one. But I'm aware of many people who have been unvaccinated and then have had several repeat reinfections. Yeah. And that's why we tell them, get vaccinated. So yeah, that can absolutely happen.
Okay, I'll work with Kenneth on this one.
Okay.
But for the Southern mayors, I'm just telling you that the South Service Center is going to be closed for the foreseeable future, and that you should send your citizens to the Greenbrier Mall, and just be sensitive to the fact that we have a shortage of staff because of this situation, and that's going to probably be a continuing situation going forward for a little while. Okay? That's all I have at this point in time. Thank you. Thank you, Dr. Paxton.
You're welcome.
Mayor Motley Broom.
Thank you. And Dr. Paxton, Mr. Schuster, Mr. Pallmeyer, thank you so much for all the information that you've shared with us this afternoon. Tax Commissioner Ferdinand, would you mind being able to just share that information about the South Fulton Service Center with us in a somewhat—
It's on my website. It's on my website. And Jessica Corbett has communication for the press, I believe, Jessica.
Thank you, Dr. Ferdinand and Mayor. Yes, we will send that out to all of the mayors so you have that information.
Fantastic. Thank you so much. I had a question about some of the information that was shared, that there were 99 COVID admissions just overnight. Those were pediatric and adult, correct? Or
I think that would be Doug who would answer that. He's our numbers guy.
Okay. Mr. Schuster, can you answer that question? He's muted.
Hey, Doug, you're muted.
It was 99 total, not 99 children.
Understood. Okay. And so I was looking at PBS NewsHour last night, and I think Dr. Fauci had made the comment in regard to pediatric cases that a lot of them aren't primary COVID admissions, but they're admissions of children who have other conditions and happen to have COVID. Is that what you're seeing in Fulton County?
I would say that's a fairly accurate description, but I don't have like up to minute details. We're getting the hospital's reporting has been slow for the last week for obvious reasons, but I would say that's probably a pretty accurate description of what you're seeing here.
All right. Thank you. Appreciate that. I think Dr. Paxton, this was probably directed toward you, that I was listening to NPR on the way into a doctor's appointment myself. And there was someone who works with the WHO who was saying that the way that Omicron is spreading, in that it is more transmissible than Delta, but seems to be less potent to most folks, is how it is the expectation of how a virus like this would mutate. And so the next, I want to knock on wood and hope that we don't have a next one, but I think we can maybe expect that. The next one would be even more transmissible, but even less potent. Is that what an epidemiologist would expect? Or
well, here's what we can tell. I mean, like everyone, none of us have a crystal ball. We do, but we can glean information from other diseases. And so, for example, I spent a lot of time working with HIV, and which is another virus that makes many copies of itself, mutates all the time. What we found is that it's often that something that has a lot of mutations in, I'm just speaking big generalities. If a virus that has a lot of mutations often is in a way though weaker, okay? It's got a lot of mutations, so it can, then infect somebody because it managed to find its way around, some of the body's defenses, but it's at a cost to the virus itself. And sometimes it's just not as potent. So yeah, have we seen that before? Yeah, we've definitely seen that before. Do we know that's going to be always the case and that the next COVID variant is going to be weaker? Absolutely, we do not know. Because, as I said, these variants, that's what viruses mutate. They mutate on their own every single day, until they kind of find, one that works best at infecting others. So we can only make, guesses about what the next variant is going to look like. We all hope that this will follow a path of, having, weaker variants as they come along. And that is my sincere desire, because I would like to go back to having a life that's not just overruled by COVID. But we don't know that for sure, but it is definitely our hope that that is what's going to happen. But at the moment, I just need to keep emphasizing to everyone that, as of today, we still have a lot of Delta out there. And, 25% of Delta is still a lot. That even as Omicron takes over and because of its transmissibility, we're going to see a lot. We're just seeing so many cases that a certain proportion of those cases are going to be serious, and they're primarily going to be serious for people who are not vaccinated. So I cannot overemphasize those points. I keep circling back to get vaccinated, and let's take those mitigation things, precautions that we know work. Masking, social distancing, not gathering together in the places where you're going to get exposed. So, I mean, nothing about that has changed at all.
Understood. Thank you.
Okay.
And lastly, I think one of the slides indicated that we've got about 60, I think Mr. Kallmeyer was talking about that approximately 60 something % of folks vaccinated in Fulton County. I would presume, based upon the level of infection in our southern cities, that the vaccination rates are lower. I think that's been the trend as we've moved forward. Is there an opportunity for the South Fulton leadership to coordinate with Fulton County to really make a push about how we get this done for our population, because
we want that. We have been desperately trying to get more people vaccinated. So the short answer is yes. We will liaise with you in any ways that in the ways that we can.
Fantastic. Appreciate it. Thank you.
Okay.
Madam Clerk.
Mayor Holiday Ingram.
Thank you so much. And thank you, Dr. Paxton, for being consistently clear in your recommendations as a medical expert, as well as recommendations of others that's based on the data and epidemiology and not being political. I greatly appreciate the way that you are handling the situation, the way you're sharing the information with us, and the way you're educating and informing and empowering us to help educate and inform and empower our residents. I have a question regarding testing, and I've been listening the whole time. And so I think I'm summing this up right in that if you test positive, then if you test positive, you should quarantine for 5 days. If you're still symptomatic, you should stay quarantined until you feel better before you go out. And when you go out, even after that, you should have on a mask.
That's true. Yes.
And so even whether you're vaccinated or not, once you become positive, you can transmit the disease. You should be quarantining, taking care of yourself until you are no longer symptomatic. And it's definitely for those 5 days, if not longer, and then wear a mask. The question I have, because I've been reading the guidelines, and again, I appreciate the information that you're sharing is consistent with that. And you mentioned it today, if you're exposed to a person who is tested positive, you should test with about 4 to 5 days later. I think be happening is people, I was at an event yesterday, and so I go test today.
Right. Yeah.
Hey, I test, I'm gonna be negative. And I'm like, oh, I'm not feeling well, so I go test tomorrow. I might still be negative because I haven't made it to the 4 or 5 day mark such that it would show up on the test. And
okay. Well, yeah, you're right. I have people all the time telling me, oh, I just found out that the person I saw yesterday, that they're positive. I'm going to go get a test right now. I said, no, you don't necessarily, if you're not having the symptoms, I'd say, hold off, wait for that 5 days, because then 5 days after you've been exposed, if you come up with a negative test, then that, you're probably good. You're probably really good. You've continued masking for another 5 days, but you're probably not going to be negative. However, if you get tested too early, it could very well, you could have gotten infected from that exposure yesterday. But if you test today, you might not, it probably won't show up. And so therefore, you could be positive in a few more days, but you won't know it because you don't get tested. So that's why we emphasize that about the 5. That's why we say that 5 day point of get tested then to see if you've been exposed.
And given the number of people that are getting tested and the long lines that we're experiencing and the demand on staffing that it is causing, do you feel at this point there should be some more guidance, clarity around that? Because if I saw somebody yesterday and if I don't have a fever today, or if I'm not symptomatic today, maybe I shouldn't go get in the line and make it longer extend the wait time. Maybe I should be waiting, to the 4 or 5. Is there a way to provide some level of, guidance or more instruction within the when I should get tested period? Because I feel like there are a lot of people who feel like they were exposed yesterday and they go and they stand in line and they're waiting for 2 hours or more, and they have a negative test. And then they're negative.
But Paxton, I think she's a plant. I think you planted her in the audience to lob you a softball.
Yeah.
Well, I'm happy to be that today. I'm just trying to help us navigate it through so that we can deal really maximize the scarce resources we have, right? Staffing capacity, but also not give people false hope and really contribute to the spread. Because if I test negative today, I'm like, oh, I'm negative, and I might be the person that doesn't go back.
Right. Yeah, no, you've hit it on the head. That's the nail on the head. That is exactly what, people need to know. Daryl Carver, who's our new Director of Communications at the Fulton County Board of Health, and of course, Jessica, they're on this call. And so, yeah, everyone needs to put our heads together about how we can best present this information to people in a way that they'll actually read it and synthesize it. Sometimes we have our problems that there's so much we want to get out to people that things get kind of lost. People have told me that said, I don't want to hear from you guys anymore. You're inundating us with stuff. So yeah, we do need, that is one of the key messages that we do need to get out to people.
And one other thing, not to make any other problems, but the other challenge of, and you said it, Dr. Paxton, once a person tests positive, they could test positive for up to 90 days, but not be able to being able or being in a state to transmit the virus after like the 10-day period. So the requirements that, and I think you mentioned it earlier, around people testing negative to come back to work or testing negative to be able to participate in activities. How do we navigate and deal with that? Understanding that, yes, it could be up to 90 days, but is it possible to still get a negative test after you have had the virus, isolated and then be negative?
Yeah, so here's what I would tell somebody is that, let's say they had a positive test, they went through the 10-day protocol and they completed that, they went back to feeling completely normal, and they're back to work. If at any point after that they then develop symptoms, they should probably go back in for another test. Just because we don't follow people, we don't get regular tests to confirm, see how long people remain positive. We don't do that. That's a strain on our resources. It's not really worth it. But what we would say is that if anybody develops symptoms again, they should probably get another test, and then we would sort it out at that time. Because enough people, while I said that the test can remain positive for up to 90 days, there are many people for whom it actually reverts back to negative, in a much shorter period than that. But we don't know who they are because we're not testing everybody on a routine basis. So this isn't sort of non-satisfactory response.
No.
But what I'm arguing against, maybe I can make this a little clearer. I'm arguing against, so I think we should, if somebody who's tested positive, gone through the protocol, and is still feeling fine, should probably be exempt from getting routine PCR testing for a period of time, because sometimes it's going to be positive, and it doesn't mean that they should be re-quarantined. However, if at any point they develop actual symptoms that make you think that they might be, positive, it would be useful for them to get a test, because if at that point their COVID test happens to be negative, then their doctor is going to start thinking about maybe other things that are causing this, flu or tuberculosis, I don't know, anything like that. So that's what I'm trying to do, is again, that's sort of that nuance. And that's when you talk to your doctor to figure out how best to proceed.
Thank you so much. I do think your response was satisfactory, and that when they return to work, they should be wearing a mask.
Yes. Thank you.
Thank you.
Vice Chair Hall.
Thank you. I have to say that unfortunately that discussion is completely incorrect as it relates to my own personal experience. When I was having cold or flu symptoms, I tested negative. When I became 100% well with no symptoms, I tested positive. I had not gone to retest to ensure that I was negative or positive, I would never have known that I was positive, because I am 100% okay, have no symptoms, but now I'm testing positive. So I don't know, that conversation completely went over my head because of my own personal situation. Thank you.
Certainly. I mean, again, talk to your Vice Chair Hall. I'm trying to to give a large amount of information to a large amount of people at one time. There's a lot more nuance to many of these things that can be possibly, given out by anyone in this period of time. So I just want to let people have people understand that. What I'm saying is, for the most part, applies to the most number of people, but it doesn't apply to 100% of people all the time. It is entirely consistent what the Vice Chair Hall's experience of a delay in the test turning positive is absolutely, it happens. It absolutely happens. You can have symptoms before your test becomes positive. It happens all the time. And so the timing of when her symptoms versus her test becoming positive, that happens all the time. I just want to understand people that I'm just trying to get the largest amount of information out there. But what I'm giving you now is not going to necessarily be the case for every single person listening, which is why I always come back to talk to your doctor about your specific situation.
Madam Clerk.
Mayor Motley Broom.
Thank you again. Someone mentioned the flu a couple of minutes ago, and it's not something that we've necessarily discussed, but obviously it's that time of year. So what are we seeing in regard to flu in the area, and what can you tell people about how to protect themselves in regard to the flu?
Well, I'm going to have Doug can tell you what we're seeing. I have an easy answer to that. Get vaccinated. We have a flu vaccine. And so I've gotten my flu vaccine. Everyone should go out and should be vaccinated against the flu as well. Also the same thing about wearing masks. I mean, that's a side benefit. Also, if you're wearing a mask for COVID protection, it's also helping you with flu protection. So wear a mask, get vaccinated against flu and COVID, wear a mask against flu and COVID. And Doug can talk to you about what we're seeing in terms of flu cases.
Quickly, without graphics, we are in a low transmission mode for Fulton County. There's only 3 people in our hospitals with influenza right now. And it is most definitely, assuredly, the reason we are in a low mode in the United States as a whole and here in Fulton County, and that flu was almost eliminated last year, was due to masking. So we do have a vaccine. I'm a proponent of the flu vaccine most assuredly, but masking really has saved our bacon with the hospitals when it comes to regard to the flu, because if we had that on top of this, we'd be in trouble. So absolutely low transmission mode in the county right now.
That's good news, Mr. Schuster. When would we expect a peak in the flu? Because December's not it. Is that right? I mean, typically speaking, in a normal year.
We do it once again. If you look, we put weekly in the weekly situation report that AFCEMA puts out. We put flu charts, and generally the worst of the flu season starts middle of December and goes through middle of February. And so we would be in the peak right now. And like I said, we would be in a much higher transmission. We were almost non-existent last year, and it's very, very low here and through the rest of the United States. So like I said, unusual low for this period, but we're in the peak time right now.
Thank you very much for clarifying. Appreciate it.
Madam Clerk.
No show of hands, Mr. Chairman.
All right, anything in the chat?
Oh, it sounds like people are signing off. It's been a long day.
We went along.
Okay, so where are we now with Mr. Kellmeyer on this page 17?
Yes. So I think, Matt, did you want to try to tee up that? And really, it was up to you, Mr. Chairman, if you wanted to open the floor for any of the activities that the mayors themselves were engaged in.
Yes, let's do that. Matt, you want to lead this?
It was just an opportunity, sir, to have an open dialogue with the cities to see, hear from them, seeing what their status is regarding open, close, telecommuting, as well as, you know, some other activities if they're looking to increase capacity for testing in their community. We have some vendors that have reached out to us that have they're available to go ahead and support those type of efforts, initiatives, if that's what they would like to do. So just want to kind of have an open dialogue moment.
All right, mayors.
Sure. Mr. Chairman.
Yes, sir.
Yeah, this is Williams. We have taken the posture to move towards teleworking since our last call. We've moved towards teleworking and closing all of our public facilities, such as our senior center, our community center, and a number of other public spaces. We were in hopes to get more guidance from Dr. Paxton, which today helps, but also in hopes to get more information at the next Board of Commissioners meeting to figure out where we're headed. We do know that there are a lot of inaugural ceremonies and swearing-ins that are in the very next few days. We don't have anything scheduled until January the 18th, so we have a little leeway, but we are focusing on making sure we keep people as safe as possible. We did not press for a mask mandate citywide. However, it is a mask mandate within any of our city buildings, should you, if you're allowed to go in any of those city buildings, but there is no need to at this time. So we are at a good place as it relates to making sure our employees and our staff members are safe.
Thank you, Mr. Mayor. Other mayors?
Mm-hmm.
Or reaction to Mayor Williams? Do I see Mayor Bakker?
I'm happy to join. Sorry I wasn't able to make it until now. Thought you guys would be over and done with.
Other comments?
I mean, you know, I'll just hop in. We're doing the same thing. We're closing down City Hall and trying to, you know, within the context of the political realities of our town, keep people as safe as we can.
Hey, Mr. Chair. Say that, right now, again, Mayor Hirsch is still obviously in office, and the protocol is followed by her lead. But right now, I'm working on a plan that will go in effect the 11th of January, which will actually be my official start day after the night of the 10th. We're looking at reviewing processes to basically come in alignment with telework. Not fully sure right now of the various apparatus required and that's at hand to make sure that happens immediately. But I am planning to make sure that shortly within a week or two, hopefully no later than that, that we abide by the CDC protocols in the whole 9 yards.
Thank you, Mayor-elect. Other mayors, what you're doing?
Yeah, East Point, we closed our customer care a couple of days in administrative offices, but we're back open. We are closed tomorrow for the holiday, but our offices aren't officially closed down. We have a mask mandate in place that's been in place August the 2nd in response to the Delta variant that remains in effect. And for our inaugurations, face masks are required, as well as a vaccination card or a negative test result within the last 48 hours.
Thank you, Madam Mayor.
And as it relates to testing opportunities, we do have a daily testing location in the city of East Point, though I've seen quite a long line there at the vault. And then Impact Church works closely with the county and CORE for testing and vaccination. I always remain open to being considered for additional opportunities, because if the need continues to, grow or continues to rise, I'd like to be able to have opportunities available to our residents within the city of East Point. So Mr. Calmer, if you like to keep us in mind for those opportunities and let us know so that we can let you know if we need to activate those.
Thank you, Madam Mayor. Other mayors, other comments?
Well, in College Park, we have limited access to City Hall. I think we discussed that last week. Customer care is open via drive-through only. And we will be offering COVID-19 testing to our employees 2 times a week starting next week. And we are re-examining our emergency ordinance at our upcoming meeting on January 4th. But I would anticipate that we would continue with that and ensure that masks are mandatory in all city buildings as they have been in the past. So we are just, and I would echo Mayor Holiday Ingram's sentiments to Mr. Kallmeyer. We're always looking for opportunities to make sure that the health and safety of our residents and the visitors to our community is at the first, it's the first priority. So any opportunities to extend testing and or vaccinations are always welcome. And as soon as I get some information that I can push out to the community about the College Park Health Center location offering vaccinations, I will do that as well.
Thank you, Madam Mayor. Next up.
Hey, Mr. Chair, this is Sheriff Labatt. I
Yes,
do
sir.
want to take an opportunity, one, to thank Alton and for his leadership earlier on a call concerning a lot of jail issues, but for all the mayors to know, we are open. We have reached out to many of your chiefs to let people know we are not refusing those that have been arrested as we've done in the past. So we're open. We're taking every precaution we have to include purchasing some additional rapid tests. So we'll be open for business.
Thank you, Sheriff.
May I ask a question of the sheriff?
Yes, Madam Mayor, you have the floor.
For those folks who may take a rapid test upon intake and test positive, what's the protocol for those individuals?
So, and that's a great question. So they're immediately sent to a quarantine zone. They're isolated. And at that point, we will retest. A lot of it depends on if they have a bond, if they need to go to court, if they need to go to arraignment. We have Zoom. They've done a good job with working with IT from the county to set up Zoom arraignments, if you will. And so we have protocols in place. Everyone has a mask. Everyone has access to N95 masks specifically. So to that end, we are quarantining where we need to quarantine, and then immediately getting people out on bond that qualify for bonds.
Yes.
Thank you, Sheriff. Appreciate all your efforts.
Thank you.
Anyone else? Is that Councilwoman Willis?
Yes, Mayor Pro Tem.
Yes, this is Mayor Pro Tem Helen Zenobia Willis with South Fulton. Our council met today. We are going to have virtual meetings for the remainder of the month, and we are going to have a staggered inauguration for the council members elect and the mayor elect on January 4th. And then we are supposed to reconvene after that to discuss the rest of the plans for the rest of the month. And most of the council members are leaning to postpone the January 8th in-person swearing in for the city of South Fulton. We have allowed the city manager put out an order to allow the staff to work from home for the remainder of the week, and clean offices of the individuals who have been infected with COVID, as well as City Hall. And we will review our teleworking policy to expand beyond the rest of the week, pending the outcome of the data that comes from Fulton County. Again, thank you for all that you do at Fulton County and keeping us informed.
Thank you, Councilwoman. Anyone else? Any closing comments, Mr. Manager?
No, I think we just appreciate having this forum. The next mayor's meeting, of course, is scheduled for the first Monday, January the 7th. I'm sure this will dominate the conversation most likely again. And then if we receive any other recommendations from the agenda committee, we'll certainly be prepared to discuss those items.
Okay. Any closing comments?
Mr. Chairman,
Yes, Mayor Bodker.
since I am hours away from being done, I just want to use this opportunity to again thank you, the commission, Dick, the entire Fulton County team for the great work that you've been doing and will continue to do. And to my mayoral colleagues, I just want to say thank you. It's been an honor to serve with all of you. And while I am confident we'll continue to work together, I obviously won't be doing it in this role. So I just want to say thank you to everyone.
And thank you for your service, Mr. Mayor. You're always a breath of fresh air. Any closing comments? Anyone else?
Mayor, Mr. Chairman, this is Jessica. I just wanted to share with the mayors who may not have heard this that Mayor Still from Mountain Park lost his mother yesterday, and just wanted to ask that we keep him in our thoughts.
Thank you for that. All right, no further comments, no other questions?
Mr. Chair, do we have an executive agenda item?
No, sir, we do not. There's nothing else on our agenda. You mean the item you talked to me about?
Yeah, the rec authority item.
Okay, I still have not seen it. Do you have anything, Mr. Manager?
No, sir.
I think the county attorney's office has reviewed it.
She's on here,
Well,
but that's not on your published agenda.
If it's not on the agenda, I don't know that we
yeah.
should discuss it in this forum.
Oh yeah, I guess I was asking, did we need to move to do and have executive session? That's the question.
Well, let's do this. Let's do this. How are we going to, because if people are on individually, I don't know how this Zoom stuff works.
Mr. Chairman, we would
Yeah.
need to quickly, if the board, we weren't aware, I'm sorry, sir, that you all would need an executive session. So we would just need to quickly provide an alternate link, since this is a public link, and we are televising this portion. So if you would allow us, we can quickly set up another link if you need to reconvene an executive session.
Okay, let's do that then. So
If you would please allow us 15 minutes to get that so that everyone could rejoin you, that would be.
So what are we doing? Excusing the mayors and we will still be in session? Is that what you're suggesting?
No, sir. What I'm suggesting is that we would keep this in case you have to come out of executive session and take any action, but we will provide you and the commissioners and clerk and county attorney an alternate link so that you may join executive session.
Okay.
Happy New Year, everyone.
Happy New Year.
Same to you.
And Mr. Chairman,
Happy New Year.
could we please have a vote to enter into executive session?
All right, so I'll entertain a motion to go into executive session. We still have a quorum?
So moved.
Is there a second?
Second.
All right, properly moved and second. To cast your votes, please. Those in favor, say aye.
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 2.
Is Morris there?
3, huh?
Morris
Morrison
left?
left. Yeah.
You don't have a quorum, right?
We don't have a
Mr.
quorum.
Chairman, I'm signing out.
Wait, we do, wait, I see Commissioner Khadijah, Commissioner Hall, myself, and Chair Pitt. That would be 4 commissioners.
So she joined.
Who did? I can't see.
Commissioner Abdurrahman. She's right here in the middle.
Okay, so that's 4.
Mm-hmm.
Okay, all right. 4 yeas and no nays. that right for it? Ms. Corbett, where is everyone else off now? We need 15 minutes.
Commissioner, what I'm asking is that you please, that because a link to this has already been provided to the public, I would ask that you leave this and that we provide you another link. I'm trying to get that set up for you, but you cannot use the
Another
same
link back
for
out
executive session
to the board commissioners.
because the link has been sent out to many people who would then be able to log in and view the conversation. And that would defeat the purpose of executive session. So
Okay.
I just need, we just need a moment and we will.
So Jessica, we're all logging off now and waiting for the alternate link for executive session. Is that